Imagine being told that to keep your job's health benefits, you have to hand over your personal health data to an AI tool from a third-party company, or else no coverage at all. That's the stark reality facing some Google employees right now, and it's sparking a heated debate about privacy, choice, and the role of technology in our daily lives. But here's where it gets controversial. Is this innovation or a sneaky way to push AI adoption at the expense of personal boundaries? Stick around, because this story dives deep into the details, and you might find yourself questioning how far companies should go in blending tech with our well-being. Let's break it down step by step, so even if you're new to these tech and healthcare topics, you can follow along easily. Google, the tech giant behind search engines and smartphones, has introduced a new AI-powered health tool as part of its benefits package for US-based employees. This tool, developed by a company called Nayya, is designed to help workers make smarter choices about their health plans. For instance, it can analyze things like how much of your deductible you've used, or suggest personalized recommendations based on your lifestyle and health info. It's like having a smart assistant that tailors advice to fit your needs, potentially saving you time and money on medical decisions. But here's the catch that most people miss. To enroll in Google's health benefits through its parent company, Alphabet, employees must grant this third-party tool access to their data. If they say no, they're out of luck, no health coverage at all. This requirement was announced recently for the upcoming enrollment period, and it's based on internal guidelines that Business Insider got a look at. For beginners, think of it like this. It's similar to how some apps require you to share location data to use certain features, but in this case, it's tied to something as essential as healthcare. And this is the part most people miss. While the tool starts with basic info like demographics, employees can choose to share more, like detailed health history, to get fuller recommendations. Now, let's talk about the backlash. Some employees are really upset, calling it a dark pattern. That's a term for sneaky design tricks that manipulate users into agreeing to things they might not want. On internal forums and message boards, like Google's Meme, workers have voiced their frustrations. One post highlighted how consent feels meaningless when opting out means losing benefits, labeling it as coercive. Another questioned why medical claims data has to go to an outside AI without a real opt-out option. It's a classic clash. On one hand, the tool could genuinely help people navigate complex health plans. On the other, it raises red flags about data privacy and whether employees are being pressured into sharing sensitive information. Google's side of the story? A spokesperson, Courtney Mancini, emphasizes that the tool is voluntary and has passed internal security checks. They say Nayya only gets standard data initially, and any extra sharing is up to the employee. Plus, everything complies with HIPAA, which is a key U.S. law protecting health information privacy. Think of it as a shield that prevents unauthorized sharing of your medical details. Nayya itself reassures that it won't sell or disclose personal data, and the tool helps track deductibles and offer tailored advice. But here's where it gets controversial. Critics argue this setup blurs the line between helpful tech and forced participation, especially since Google is pushing AI hard to boost productivity. Is this a fair trade-off? Or does it prioritize corporate goals over individual rights? To put this in perspective, Google's not alone in weaving AI into the workplace. Companies like Meta are using AI to track employee habits and even gamify adoption, while Microsoft has made tools like GitHub Copilot a must for some teams. In healthcare specifically, firms like Salesforce and Walmart has rolled out similar AI-driven benefits platforms, such as Included Health, which helps workers access care more efficiently. For example, Included Health might connect you with therapists via app, making mental health support as easy as ordering takeout. So, is Google's move just the next step in a tech-driven future, or a slippery slope toward less privacy? What do you think? Does the potential convenience of AI health tools outweigh the privacy risks, especially when opting out means losing benefits? Is this coercion or smart innovation? Share your thoughts in the comments. Do you agree with the employees' concerns or see it as a necessary evolution? We'd love to hear your take, as this debate touches on bigger questions about technology and trust in the modern world.